our next session, we're going to keep this going. So is how mental health providers can help patients access affirming medical care, presented by Maggie Price, PhD. Dr. Price is a licensed psychologist and assistant professor at Boston College's School of Social Work, where she directs the Affirm Lab. She has spent her career focused on improving mental health care for marginalized communities, particularly transgender and non-binary youth. Her research develops and tests gender-affirming mental health interventions that support transgender and non-binary youth's access to inclusive, evidence-based care, including supporting gender-affirming medical care navigation. Dr. Price has received several national awards for her research and has delivered over 35 invited talks and keynotes on gender-affirming care and mental health equality. Dr. Price, welcome.
Thank you so much, Kara. I am going to share my screen. Okay. Looks like it's successfully shared.
Looks
Okay,
like
great.
it.
Awesome. Thank you so much for that wonderful introduction. And thank you, Alex, for such a fabulous presentation to start us off for the day. Today, I'm going to be talking about how you as mental health providers can help your clients and patients access affirming medical care. As stated, my name is Maggie Price. I use the she, series pronouns, and I'm at the Boston College School of Social Work as an assistant professor. Okay, so today our agenda, I'm going to very briefly talk about who I am and how I know the things I am teaching you today. I'm going to talk about the problem that the research that I did that informs this presentation sought to overcome. And then I'm going to tell you about gender-affirming psychotherapy broadly, which is a treatment tailoring method to use for any mental health therapy that you provide, as well as a training program that we created that goes alongside it. Today, I'm going to give you part of that training in this series. But we have a module that focuses just on how to help clients access affirming medical care. So I'll be giving you that module today, and that includes those two steps right there. And then we'll have a quick wrap up. Throughout this time, my colleague Madeline will be sending you some information in the chat. There will be some various links and resources that we give you. The full list of resources that I talk about today are also provided in your folder for the CEU, for today's CEU presentation. So that should be there in PDF, as well as these slides to refer to. And if you have follow-up questions, of course, my contact information will be at the end of this presentation, and you're welcome to reach out for any additional information or resources. Okay, so who I am. So I'm a cisgender woman. So although I'll be talking about best practices for transgender clients and patients, I have no personal lived experience as a transgender person. And so all of the research I do is deeply community engaged. So all of the training materials, even how it looks and what we say, have been co-created with transgender clients of all ages, as well as their families and mental health providers who have expertise in serving them. I do this under a couple of hats. So I'm a licensed counseling psychologist by training and a researcher by profession. So everything I present to you today is evidence-based, it's based on research, and it's based on community voices. And because of this research, I have expertise in best practices for supporting transgender people, particularly in mental health care. And I do work in schools and medical health settings as well. But I would say most of our work focuses on supporting folks just like you, mental health providers who want more skills in how to be affirming and supportive to their clients. And this is just a photo of my research lab. We are the Affirm Lab, and you can learn more about us at our website, www.affirmlab.org. Okay, so with that, we have learned over our many years of training providers that you like interactivity. I know I do, especially in these Zoom type webinars. So we're going to use the chat function a lot in this hour. So please participate as you're comfortable. So the first question, I want you to write yes or no in response to two different questions. The first question is, have you ever worked with a transgender, non-binary, or gender diverse client? And I'm just going to keep my eye on the chat. A lot of yeses. Good, some no's. Great, so a good variety of experience working with at least one client. I'm glad to see that. My second question is, have you ever referred a client to gender-affirming medical services? So this would really probably be just among the people who said yes on that first question. Just staring at the chat, reading. Okay, so a lot more no's on this second question. Perfect, because that's what we're going to be learning today. So the problem, the reason that I did this research in the first place was because there was a big problem to solve. We know that from research and people's lived experience reports, that transgender people are regularly met with discrimination or untrained therapists when they seek care. And many therapists want to learn best practices for supporting transgender clients. So we know that this isn't, that the reason that discrimination or lack of training is happening to transgender clients is not because therapists don't have good intentions. They do, right? That's why you all are here today. You want to learn best practices, but not everyone has access to this training, right? And part of that is because until recently, these practices weren't clearly defined, and training was often hard to find. And as Alex mentioned in the last presentation, this has changed a lot over the last decade, but we still find that providers report to us that it's difficult to figure out, what's the best training, what's evidence-based, how can I get this information, how can I get this information quickly? So another quick poll for you all. Have you been trained in best practices for supporting transgender clients? Again, that's just a yes or no. All right, we're seeing kind of like a 50-50 split. This is great. And more no's than yes. And that is probably why you're here today. So I'm so happy to see you all here. I'm getting this information. This information is more important than it ever has been, because as Alex outlined, and presenters I'm sure outlined from yesterday, the world is a lot worse right now for transgender folks than it has been in a long, long time. And that is especially true in healthcare and mental health care. Okay, so the solution that we started working towards was to co-create a treatment tailoring approach called gender-affirming psychotherapy. So this is a compilation of best practices that any mental health therapist or provider can use to modify their existing treatment. So whether you use CBT or DBT or psychoanalytic skills, you could use gender-affirming psychotherapy skills and principles to modify whatever you're doing. So it's not like a manualized treatment where it's like session 1, session 2, session 3. It's really just, here's what you can do at intake. Here's what you can do, during treatment. Here's what you can do for different presenting problems. And we co-created this with transgender patients, parents of transgender youth, as well as mental health providers, to help ensure that we really encapsulated everything, all the information that was relevant to the various parties that are involved in mental health care. We also created an interactive online training. And the reason we made this training online was because mental health providers asked for it to be online, and it's interactive, right? Similar to how you'll experience today's presentation, hopefully. We know that learning is most effective when people are engaging with the material. So we created this really robust online training using best practices in psychology and behavioral change to teach mental health providers these skills. And we'll be giving you information on how you can access this training if you're interested in just a little while. So gender affirming psychotherapy, just to tell you a little bit more about what it is. It's 38 skills and 27 principles. That kind of sounds like a lot, but I promise it's actually pretty straightforward, and we categorize everything so it's not too overwhelming. And the skills are really just like things you do or don't do. And principles are just like the key knowledge that you need as a mental health provider to be as affirming as possible. Example of a skill is asking about gender inclusively during intake. And an example of a principle is that family support is a key protective factor for the mental health of transgender folks. That's true, of course, for all people, but we're talking specifically about family support for gender identity. So if you want to learn more about how gender affirming psychotherapy was developed, you can read our paper, and this link will give you, it's a link to a Google Drive document, and Maddie put it in the chat as well. And that has no restrictions, so it's not behind a paywall, you can read it. If you go to box 1.1, you can see all of the skills outlined. So even if you don't have the funds or the time to do the training, you can read exactly what's included. If you look at box 1.1, that has everything you need and more. And then I also did a podcast for the journal that published this paper that gives you an overview of the training, and that's in psychiatric services. Okay, so as I mentioned, we also did a training. And so I'm just going to pitch the training very quickly. Again, you're going to get a taste of it today, but for you or your friends or colleagues who might want more information and education, I'm going to tell you a little more. So it's 8 hours, it's interactive, online, and self-paced. So it's on the longer end, right? But you can pick it up and drop it off whenever you want. You don't have to do it in one sitting. You just do it as, between clients or on your lunch break. It really heavily relies on real stories from transgender patients and their providers. So again, that lived experience of like what therapy, what clients want therapy to look like, how mental health providers do the therapy. It's heavily integrated, and there's tons of different activities as well in this training. And you can earn up to 9.5 CEs, and that's up to because it differs based on like if you're a licensed social worker or psychologist or mental health counselor. And it's $100 for 9.5 CEs. Okay, so these are the course modules in the training. So you start out by talking about the benefits and goals of gender affirming care, do terminology, blah, blah, blah. By the end, you get to advocacy, and Alex just did a masterclass on advocacy. But if you want to dig deeper in how you can do advocacy as a mental health provider, module 10 provides that information. And there's all sorts of great stuff in the middle. Some of our favorite, our providers love clinical skills a lot. They love that is one of the favorites. And then developmental tailoring. So how do I think about, how to change psychotherapy at different stages of the lifespan? Today, we're going to be doing help clients access other services. Okay. So this is where you can sign up for the training. We also have like a video in the beginning. So if you just want to like watch a 2-minute video about what to expect in the training, that gives you that information. And then again, if you have any questions, you're super welcome to email me after this. And Maddie just put that also in the chat, so you don't have to grab this QR code if you haven't already. Okay, so a key part of gender affirming psychotherapy is helping access transgender patients sorry, a key part of GAP is helping transgender patients access affirming medical care, right? So historically, mental health providers have been put into this gatekeeping role where we are asked in many cases to provide letters of support for medical care. And this can be really complicated for the therapeutic relationship. And what we know is best practice is to talk to clients in the beginning of therapy that we are willing to do this, and to use best practices when we do write these letters. Gender affirming care, kind of the broad umbrella definition of gender affirming care, is social, psychological, and behavioral and medical interventions that are designed to support a person's gender identity. So gender affirming care is often kind of used to just refer to medical practices, but really it's a broad umbrella that also includes what you do in mental health care. Sometimes it's called gender affirmative care or trans affirming care. Now, question for you all for the chat. What is an example of gender affirming medical care? Like a specific service. Hormones, yep, hormone treatment, awesome. Any others that come to mind? Yep, surgeries. Testosterone is a specific hormone. HRT is hormone replacement therapy, which is also the same as hormone therapy. Excellent. Pap smears for trans men, psychiatric treatment, hormones. These are great. Surgery, how they're treated in the office. Yes, that's definitely a big part of the larger umbrella for sure. So, I am no medical professional. I'm not a surgeon. I know the basics about these services. So I'm not going to be educating you about the details of these services, but I am going to kind of tell you some of the key medical practices. So these are just some examples of common ones that your clients might be seeking. And they may or may not, right? So just to be clear, transgender folks may or may not seek out gender affirming medical services. Some end up engaging in lots of services, some don't engage in any. So we shouldn't make any assumptions about, kind of interest, but we can always tell clients that we are open to having this conversation and helping them navigate the process of accessing medical services if they so desire. So hormone therapy, sometimes called hormone replacement therapy or HRT, like someone put in the chat. That's very common treatment, which is probably why it came up a lot in the chat. Facial feminization surgery, chest reconstruction surgery, also referred to as top surgery, vaginoplasty, medoidoplasty, bottom, which is known as bottom surgery. And I apologize if I pronounced that last one incorrectly. I may have. These are some of the common ones. And as a mental health provider, you absolutely do not need to be an expert in any of these medical services, right? You are just the person that provides the facilitation to these services through a letter in most cases. And so we're going to talk about how to write those letters today. And also how to find affirming medical providers so that you can help your clients access those services through proper referral. Okay, gender affirming medical care. Why do you think it's important or helpful? Again, answer in chat any thoughts you have, and understanding that we're in a time and place right now where we're hearing a lot of messages about how it's not helpful. I'm curious if folks have either had clients who have talked about what's useful about it or why it's important. Maybe have lived experience having affirming medical care, family, loved ones, to begin the process of change, to support mental health. Absolutely. It involves a holistic medical model, totally. everyone has the right to care, absolutely validation of self and identity. That is absolutely true. Quality of life improvement. You all are really well educated on this already, I see. Can help clients solidify their connection with their identity, dignity, and respect. Best practice and advocacy. All people deserve dignity and respect to have the option to trust in their medical services. This is so great. You all are nailing it. To help authenticity, dignity, and respect. Yes, 100%. And our job as mental health providers is to help facilitate dignity and respect and well-being and good mental health and identity affirmation. And so by helping clients access medical care, we can improve their mental health, which is really our goal, right? So research really clearly, and there's just a few great citations here. And I think those citations are also in that PDF document too, if you want to read up on the scientific articles. But it's research, this again, despite what our political administration might say, gender-affirming medical care has been shown to improve physical health and mental health. Just as a couple of concrete examples, it's been shown to reduce suicidal ideation, depression, and anxiety. So really important mental health outcomes. And these are just some of many. And as someone put in the chat, it also improves quality of life, right? So sometimes we, as mental health providers, we focus on like symptom reduction. And we also focus on how to improve well-being and quality of life, right? Improving self-esteem, improving enjoyable activities, improving community connections, right? Kind of those, increasing those positive experiences. And gender folks who have gender-affirming medical services see improvements in those domains of life as well. So this is really, really important for the overall, as someone said in the chat, holistic picture for a person's health. Now, I know you just did a whole hour on the legal landscape, and I am not a lawyer and I am no legal expert. But I do want to make a note that's specific to facilitating access to medical affirming care. Some forms of affirming care, like puberty blockers, are considered illegal in some states for minors at this moment in time, right? And I know Alex already reviewed all of this, and we're going to give you some resources to understand the legal landscape in your locale. I noticed that a lot of folks are in places where there might not be a lot of resources, like local in-person resources for gender affirming care. And so I'm going to give you information or resources for how you can learn more about your specific geographical location. It might also be illegal to write referral letters or discuss affirming care with transgender minors in some states. Again, these are all specific for minors. I should have underlined minors in that first line as well. And again, this varies by state. It varies by age of your client. And it's important for you to know what is allowed or not allowed at the time that you are considering providing the support in your state, knowing that people like Alex are working on changing this and getting transgender folks' rights back. Okay, so yes, kind of the TLDR of the slide, know your local laws. We recommend consulting with your licensure boards for practice guidelines. The Movement Advancement Project, Maddie put this and several other important resources in the chat. The Movement Advancement Project has maps. They're called equality maps, and they're also hosted by GLAMA on their website. You can look at like your state specifically. It's like a super cool interactive website that's updated all of the time, and you can look up what the laws are in your state. And so I highly encourage you to check that out. And again, you don't have to do it right now. You can do it after the presentation because we are giving you, because these links are in your handout. Also, the trans legislation tracker is another great resource that we recommend. Okay, so let's get to the clinical skills. How do you help patients access affirming medical care? There are two skills we're going to review today. The first is building a referral network. The second is writing referral letters. And we're going to do little mini activities for each. So building a referral network. What this means really is just building a network of trusted medical providers that you're like, this is my go-to person for gender-affirming surgery, or hormone. This is my go-to endocrinologist for hormone therapy. Why is it important to have a list of providers who you can refer to? Clients always need options to support their needs because you can't be an expert on everything. Absolutely. The continuity of care is always maintained. Yes, absolutely. Yeah, knowing the providers and collaborating them with is critical. Having resources, competent referral sources for clients that meet their needs. Yeah, right. Not all providers are made the same. It's not just because you're providing a service doesn't mean you're doing so competently. Yeah, knowing providers you can trust, absolutely. To get in contact with those who are experts in one's needs, exactly. And that gets back to like, you are not an expert in surgery. I mean, maybe one or two of you might be, but probably most mental health professionals are not also surgeons, right? We need to have trusted people we can collaborate with who do have expertise. Providing a sense of community, absolutely, right? If you're like, hey, my former client has seen this medical provider in the past and they have found it really useful, that does a whole lot to help your client feel comfortable and excited, and confident about seeing that provider, especially because transgender clients and patients, they face so much discrimination, not just in mental health care, but also the medical care world more broadly. Help the client not to have to start on square one, not all the responsibilities on their shoulders. Absolutely. The process of transition is a ton of work. If you can help your clients navigate this by giving them a list of folks that you have vetted, that hugely helps them. All right, you all are doing awesome. So, okay, so why is it important? So you already said all of this, but transgender people encounter unique barriers to medical care, right? Having someone help them navigate that as a mental health provider is awesome. And these barriers can exacerbate or cause distress, right? So they're already dealing with everyday discrimination, potentially rejection from their family, and the mental health problems that we know arise because of discrimination and victimization. And when they go and seek affirming services and are met with more discrimination, that's going to worsen their mental health problems. So having you there to help them access, reach the more affirming providers is great. So, yes, that's just a rephrase of what I think I just said verbally. Also, if you kind of have this list of people who you feel comfortable referring to, it also can reduce potential harm that they may face when seeking care. Okay, so how do you build a good referral network? I'm sure you all have a great referral network in a lot of domains. So we're just going to focus on these gender affirming medical services. So we recommend creating and regularly updating a running list of providers, like create a Google Sheet, create a Word doc, whatever, technology you want to use. Or you have a provider list of surgeons, endocrinologists, primary care docs that you are regularly referring to. Ideally include providers who have been vetted or recommended by trusted colleagues and clients, right? Being able to do that warm handoff, like someone said in the chat, and saying like, I have experience with this person. They're fabulous at doing these services. That is awesome. It's ideal though, right? And for folks who've not worked with transgender clients before, you might not have that list readily available. So we're going to give you some information to help you start creating that list. Consult trusted sources. So here, Maddie's going to put in the chat a few of these resources that we really recommend. So WPATH is one. Alex mentioned that one. Trans Health HQ is a really awesome newer website that has that helps clients navigate the whole system. So you can look at okay, this is the kind of service I want, and here are the lists of gender-affirming providers who do that service in my area. So it's geographically specific. We really like it. The LGBTQ plus health care directory is also a really great resource. So a couple of those links are in the chat. So I'm going to ask you now to build your own referral list based on a case example. I'm actually probably just going to ask you to find one provider, but this is your activity for this, your first activity. Okay, so on the next slide, I'm going to have you read this case example. I'll read it out loud also. And I want you to use the healthcare directory or the WPATH member directory. Again, the links are in the chat, to identify one provider that is local to you that you can refer the client to. Now, I understand. Now, if you already have the person in mind, just put their name in the chat. If you don't and you want to use these, but then we're asking you to use these resources to find someone. Now, I understand these folks aren't already vetted by you, but because they're on these directories, there's some they have already been vetted by another entity that is trusted, and so we encourage you to use those directories. Okay, so here is the example. Maxwell is an 18-year-old mixed race Black and Asian transgender woman, has been seeing you weekly for therapy for 6 months. She sought therapy to address anxiety and depression, for which she was self-medicating with alcohol and marijuana. She attributes her mental health difficulties to the bullying she experienced in high school and lifelong verbal abuse from her parents about her gender expression. Max is interested in starting hormone therapy and wants FFS. So now your directive is to use those resources or your known providers to recommend, to put in the chat a person who provides the services that Max is interested in. You can just do one or the other for the sake of time. And extra bonus points if you put in that person's web address or profile or something. Awesome. I'm already seeing some great work. Awesome. And if you wouldn't mind in the chat saying, what is the service? Is it surgery? Is it hormone therapy? This is great, seeing them roll in. I'll give you a few minutes to do this. I'm seeing some problems navigating the website and or not knowing folks in your location. The directories, and also, I guess, Maddie, could you put in the Trans Health HQ? That can be specific to your that helps you kind of find one that's geographically specific. So Sammy, that might be a good resource for you. Awesome. Thank you for following up with a specialty. No one in my location. That is rough. And, it underscores what we know, which is that access to affirming services are limited. I think, so I'm in Massachusetts. We have a really great listserv here, like a New England-based listserv for gender-affirming medical providers. Sometimes kind of finding people who are kind of like secretly doing affirming medical services is something that I see folks do in like New Hampshire and some of the more less affirming places. And so I always recommend that if you're having a hard time helping your clients access affirming care, reaching out to your local licensing boards and asking if you can get support. American Psychological Association also has a really good network of gender affirming mental health providers. And just taking the websites that we give you and looking through, a lot of people use Google, but that doesn't always result in the best results. Jeez. Huge disparity. Yes. Lots of work to do in Southern Georgia. And that really gets back to the advocacy piece, right? And I think, in cases where, a lot of clients end up getting affirming services outside of their state that they live in. And so looking to your nearest state that might have more affirming policies to help them out, helping them figure out transportation, financial coverage for those services. Those are all really important. Yeah, Boston, we have lots of options, fortunately. Oh, that's super helpful. Yeah, so Margaret shared that they live in Arkansas and serve clients in North Carolina, but North Carolina is a better place to live and has more services. So yes, that's, just kind of similar to finding abortion services, right? There's a lot more coverage on that often. But often clients have to leave their place. So it seems like this has been a validating exercise for others who have seen that other people who live in non-affirming places are struggling as well. Oh, that's interesting. There must be something wrong with that. I'm just sorry. I'm just reading. I put in my zip code, says 15 providers, but they're all out of date. I wonder if reaching out to the directory, administrator could help. Okay. Well, I hope that at least, for those of you who are struggling to find local providers, this is really unfortunate. And I'm sure if we had done this exercise a year ago, it might have been slightly better, but maybe not that much better. Fortunately, these national directories do exist. And from my experience, the folks who run them are really responsive. So I think if you email like the help desk or the contact line, it can also be, they might be responsive and help you navigate your specific area better. And again, like quiet listservs or Facebook groups can be good for finding other folks who are allied with you on gender affirming care and other issues and might have their own kind of quiet secret referral list. Okay, noticing the time, we better move on. But thank you for participating in that activity. Okay, so let's talk about why writing referral letters. Why is it important? I'm going to skip this and just tell you because the answers are very similar to the last one. And I want us to have lots of time. So many insurance agencies and surgeons require letters from mental health providers prior to delivering care. So again, this goes back to that gatekeeper role that I talked about that we often have as mental health providers. It's very variable by provider, it's variable by insurance agency, and it's variable by location. So there's a lot of pieces that you need to be aware of as a mental health provider. So how do you do it? How do you write a referral letter? There's a couple, I think there's a lot of confusion sometimes about referral letters that you have to kind of testify to this person's gender identity and say, yeah, they're definitely transgender. I know because I'm a mental health provider, as if that's something that we're able to understand fully or testify to about someone else. And that's not actually the case. That is just a myth. So I'm going to tell you what is included in a referral letter and give you some resources for how to do it in practice. So first, identify the letter requirements for gender affirming care. So I just said that they vary by state, they vary by agent, the insurance agency, by provider, etc. So it's important for you to reach out to the insurance company if your client has one, figure out what do they need for that company for that insurance. Reach out to the provider, ask what do they need in the letter, like what information do they need, do they need a letter, and the insurance agency requirements will vary by state, so you don't actually have to reach out to a state entity. It's just those two. Second is to assess the client's capacity to consent. We'll talk about that a little more. Collect information for the letter. I'll tell you what the information is momentarily. Okay, so here we're going to go through each of these 3 steps in greater detail. Sorry, I see a question in the chat that I do want to address. Is there liability involved in the referral potential? Yes, there is liability if you are living in a state where like enabling, this is the word that is used, unfortunately, a minor, so a client under the age of 18, if you are writing a letter for someone under the age of 18 to get gender affirming medical care, in some states, albeit very few states currently, you might be violating a law. Even though, again, as Alex mentioned, this is all evidence-based practice that all professional associations recommend we do, the law in a few states say you ought not to do that. So again, if you are unsure, I strongly suggest reaching out to your local licensing boards and looking up on the Equality Map resource what the laws are in your state. And you can, of course, always consult a lawyer, but that is often easier said than done. And again, this is few states and it's only for minors. Okay. Write referral letters. Okay, so how do you do number 1? Identifying letter requirements for gender affirming care. I kind of already went over this, but I'll do it again. So just to be very clear, the required type of information and the number of letters varies based on the service. So hormones versus surgery, for example, you might need more letters for surgery and fewer for hormones, or none at all for hormones. It also varies by the provider you are referring to. So again, contact that provider and say, what do you need in this letter? The location that you are in, the client's age, again, that minor versus non-minor, that makes a huge difference, and the insurance. So yeah, and even like just to like really take the point home, what Blue Cross Blue Shield says you need in one state is different than the next state over. So just, you do have to do your due diligence to figure out what is necessary. So yes, an example of this is right here. So Texas requires 1 letter for a mental health provider for hormone therapy, but 2 separate letters for vaginoplasty and menoidoplasty. So those are surgeries. Okay. So the second step is to assess the client's capacity to consent. Again, this is not about proving identity or saying like, yes, this person is transgender. You are assessing their capacity to consent, just like you do in the beginning of mental health therapy. So that's the patient's ability to understand relevant information, retain it long enough to make a decision, and communicate the decision clearly and consistently. And so you testify to that in your letter. And we're going to give you examples of letters in just a little bit so you know exactly how these are written out. The third is to collect information for the letter that you may or may not already have about the client. So general characteristics like demographics, the provider's qualifications. So that is your qualification to write this letter. So I'm a licensed social worker in this agency, whatever. I've been seeing this client for X number of weeks. Yes, duration of relationship with patient, assessment of the patient's mental health. Now, again, you don't want to disclose an abundant amount of detail that's irrelevant to surgery or service. So you might want to, generally speaking, you want to state what the patient is comfortable with. And again, only disclose what is relevant to the specific service. And we have a lot more guidance on the nitty-gritty of this in our training. A statement that the criteria are met and the clinical rationale for the procedure. Third, collect information. Oh, sorry, we're just continuing. So more information. So the patient's expectations of the procedure. So you want to be able to document that the client understands the risks of the surgery. So, for example, client so-and-so, completed informed consent with the surgeon about, potential risks of hormone therapy to their fertility. If the patient is under 18 years old, you always need parental consent. Despite the myths that we might hear on TV, you always need parental consent for gender-affirming medical care. Confirmation of adequate support during and after procedure. So, if your client is getting surgery and won't be able to take the bus home, then you want to make sure they have a ride home and someone to take care of them in their post-surgery state. And your availability for care coordination. So I can be reached at this number if you have questions about this client's, readiness or whatever. So this is like, I'm just going to show you kind of the video on the training. So you can see if you're like, whoa, 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 I'm not ready to do this. I don't blame you. There's a lot of detail here. If you are ready, that's awesome too. And we're going to give you some resources to, read more and have really good examples to use for your practice. But in the training itself, I don't know if you can read this or hear this, but basically there's like a voice that's gonna walk you through how to do this and read through the instructions. So I'm just gonna give it a moment. And at this is like the part of the training where you are asked to practice writing your own referral letter, and you're given examples of a short one for FFS. This is all for the same service, so that's facial feminization surgery, medium, and long. And we'll just look at this for like 30 seconds. So we give you like an actual letter to fill in. And then the person doing the training just, fills it in. Oh, with today's date, that's cute. I didn't realize we did that. And so this is based on the case we just talked about. So I think, we of course provide these resources because it makes something that I think can be a little overwhelming for folks, or daunting, or like, I don't have the expertise, like pretty straightforward. And then we have these like bracketed spots for where you just put in the basic information that you know about your client already. And then, yeah, this is just a video of someone doing this in the training. So we walk you through the whole thing in the self-paced in the actual training, and we're going to give you those example letters or we already gave them to you in the PDF. Okay. All right. So perfect. We're at 10:45. Let's wrap this up. Just to be clear, helping clients access affirming medical care is just one part of being a gender-affirming therapist. As I already talked about in the beginning of this presentation, there's a whole lot of skills to learn. They're all really simple, straightforward, and easy. Again, it takes 8 hours total, and you can do this across a month's time learning. We're also coming out with a book on these skills and principles. And there's also lots of awesome resources out there that include many of these skills and principles too, that I'm sure you all have already looked at. So if you are interested, though, you can go to my website, affirmlab.org, and then you go to GAP training. That stands for Gender Affirming Psychotherapy Training. The QR code goes there, and then Maddie just put that link in the chat. That is okay. All right, thank you so much. I'm gonna put my email in the chat. It's not on the slide. So what questions do folks have?
Maggie, we do have one question in the Q&A. It says, are there long-term studies that follow individuals who have medically transitioned?
Yes, there are. And they demonstrate mental health benefits, including kids who have medically transitioned. I know the kid literature very well, and research shows that kids who have medically transitioned, their mental health looks just like cisgender kids, which is awesome. We know that transgender kids who have not transitioned, their mental health is worse at the population level. Excellent question.
Do you have a link to that study by any chance?
Maddie, is that it's like Kristen Olson's research for that study specifically, but let me pull up our resources to see if it's already in there. If not, we can find that for you for sure.
Perfect. If there are any more questions, y'all can put them in the Q&A or even in the chat right now, just because we are monitoring that. What would you say, Maggie, would be like one simple thing someone could do to make their practice more gender affirming, like just to start?
Yeah, absolutely. Uh, couple things you can do. You can at intake ask your patients how they identify their gender. Uh, your patients that you support transgender and non-binary and gender diverse clients. These are statements, and you can put them. I highly recommend putting them in your informed consent, your website if you advertise online, any sort of kind of patient recruitment materials, as well as in verbal statements during intake and your informed consent procedures. And the reason I say that you should do it kind of in all of these places is that transgender folks often, especially in places with a hard, where it's hard to find gender affirming providers. They need to know who's safe, right, to go to. They need to feel at least see some evidence that they won't be discriminated against when they access care. Now, that said, big caveat, if it is, illegal in your state to, support transgender youth, for example, as a mental health provider, even though that's true of only a couple of states that I'm aware of, you might just do verbal, right?
Mhm.
Having, and I think on like an intake form that's not necessarily going to be seen by the public, you can include gender identity. You should include gender identities, regardless of where you live, that are not just male and female, right? There should be a gender option that has an inclusive. It should have a write-in, and there's good guidance online for kind of exactly what language you can use to modify your intake form.
Michelle asked, would you consult with a LGBTQ attorney before, I'm guessing she's saying like writing a letter or maybe putting that in your paperwork? I'm not entirely sure.
Yes, associations like GLAMA with lots of lawyers who specialize in this would be a helpful resource for consultation. Definitely, that is one recommended resource. Your local licensure board, like your state licensure board, should have an attorney you can talk to about whether XYZ practice is allowed. But I like that idea of also reaching out to GLAMA or similar organizations to get some guidance.
Yeah, yeah. If I make a mistake in language or assumptions, what's the best way to repair that relationship with my client?
Excellent question. Apologize. So we recommend that you repair by saying sorry, but not being like overly, you know, kind of like you centered about it. So just making that a quick apology, say like, I'm sorry, I'm, I'm still learning, I'm working on this, that, I'm gonna work on doing better. And if I don't want to burden you, but if you notice that I make mistakes or upset you in any way, I always want to know about it because I'm trying really hard to be as supportive as possible. And I make mistakes. That's actually a little long-winded what I just did. But make it short. Don't make it about you. Don't start crying. But acknowledge your mistake and say sorry.
Yes, yes. And then I think maybe one last one. How do you make sure like standardized assessments are gender affirming or okay to use for the population?
Excellent question. I think first and foremost, I look for whether they use like binary sex. If they do, and you really like that survey, or that's like a well-validated instrument, I always just let clients know, like, hey, so I didn't create this survey, but I think it's really useful for assessing PTSD or what have you. I just want you to know that it does have gender as a binary on there. You can skip, if there's like a specific question at the top that's like M versus F, like you could totally skip that, or kind of just like let them know what the options are at your specific practice. Sorry, I should also say, I know earlier I said to change, your intake forms. If you can't do that because you work at an agency where you don't have that level of leadership or control over the situation, you can advocate for change. And also you can just let clients know, like, hey, I wish we could change these forms, but unfortunately they haven't been changed yet. I just want you to know going into this that the packet of, surveys I'm gonna ask you to do are not affirming, but I am as a clinician.
Awesome.
Yeah.
All right. I think that might be it. I don't see any more questions. It looks like Madeline put in that research study link that people were looking for. So, and I think that will also be added to our info sheet that we include in your handouts. All
Yes, and on
righty.
the last page of the resource document is specific to our presentation. There's, I think, 7 or 8 studies that you can look at that talk about the benefits of gender affirming medical services.
Awesome. Awesome. All right.